Hey, this is Tracy. I'm going to show you in this video that may end up being 15-20 minutes long, maybe not, but try to just be patient with it. I'm going to show you some things about muscles with your rotator cuff and the muscles that help you stand and walk. Because I believe the more knowledge you have, I tell my clients this all the time in my books and my videos, the more knowledge you have, the better you're recovering what you're coming from, whether it's people in stroke recovery or fall prevention or things like you're going through, strengthening your body enough to get back and walk and be independent again. So I'm going to start quickly with just a little bit about the rotator cuffs, and then I'm going to go into some of the things to do with legs and walking and standing, because I think there's a couple things that will really help you here. And depending on your physical therapist and your doctors, you may know a lot of this already, but you may not, because sometimes they may throw out abduction, adduction, the word rotator cuff, in different movements of muscles, and you may not really follow completely along with them because it may not completely make sense because you weren't trained in it. So I'm going to start with your rotator cuff muscles. You have 4 rotator cuff muscles. It's not just a cuff. And the 4 rotator cuff muscles help. So you have the shoulder joint. Your joint is a ball and socket joint, like like your hip joint. It's a ball and socket. It goes like that. So you have the joint, but then you have the girdle. Just like you have the pelvic girdle, but then you have a hip joint. So you have your shoulder girdle, and so you need to keep yourself in good posture to keep your shoulder girdle in placement, proper alignment, so when you move your shoulder joint through range of motions and different movements that it makes, because it's a ball and socket joint, it makes all kind of movements. It can heal better and the movements will be better because you're not like this. It would be like taking your leg and kind of bending like that, but you're trying to make it do movements, but you're taking the pelvic out of position so the ball and socket of your hip can't line up. So right here is, and the words may be backwards unless I have time to flip the video when I'm done. So this is the rotator cuff muscles. There are 4 of them. This is your front view. You can see the clavicle. The other side, wait. Yes, this side is the front view. That's your collarbone, the clavicle bone. This is the back view. There's 4 different muscles in there. All 4 muscles help keep your shoulder joint and girdle in place. There's a lot of ligaments and tendons in there. Plus, they all have kind of the same job, but they all do different jobs. So it depends which one has the injury in it, or which ligament's torn, or whatever's going on there, to which exercises they end up giving you. And a lot of therapy just gives everybody, no matter what they're going through the rotator cuff, they hand them the same piece of paper with the same exercises to do. But it depends which muscle and how you work through it, because each one helps with different movements. So I'm hoping you have one that follows along great with you. That would be great. I like how you said they're helping you with your arm when you're doing movements, so that's excellent. Don't do anything I tell you, give you advice on, that causes you pain. Always run things by them. You can say, my daughter sent me this video. Help me. What do you know? She told me about these muscles. So basically, your rotator cuff muscles are, I'm going to switch my glasses. Not that you have to memorize this, but if you hear them saying the things, it might make more sense to you. So you have the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. They're all the muscles that are considered the rotator cuff. So that helps people understand a little more, because most people just have a visual in their head. There's a cuff there, and they don't really understand what ligaments and what's torn. And what I do for a living, I don't always know when people come to me, because they've already had their therapy and the doctors, because I'm not a therapist, and they say, I have an injury in my rotator cuff and my therapy's over, can you help me? And I'm like, do you know what muscle's torn? Do you know which ligament? Because that would help me help you. And they don't always know. So this, sometimes you can ask them now, I heard there's 4 rotator cuff muscles. Can you tell me which one has the issue? Because in the MRIs, they can see things. But just to give you a little heads up on that, there's so much things that are attached to here, the bicep, the tricep, the deltoid, the rotator cuff muscles, even the chest muscle comes and attaches right through here. Even in the MRI, sometimes they can't see exactly clear what's going on. It's usually once they get in for surgery. So you don't always know. They may not give you the exact answer because they don't know complete details, but they may know enough to say it's this or that. But I think I heard this was you too, but just in case it is, often it could be one of the bicep tendons. See how it's attaching up there? In through there, same area, shoulder area, attaching up to here. You got the triceps, which is the back of the arm, you know, back here. The biceps is the front, you know, ooh, that's your bicep. That's a bicep two-headed muscle, two ligaments going up through here. Sometimes they tear off or they get torn. Sometimes they completely disconnect and people get the biceps get this little ball here. So just a little knowledge for you to help you with that, because that will maybe make more sense when you hear them talking. And yes, I'm going back and forth to the camera because I'm grabbing pictures and I want to keep my chair far enough away so when I show you sitting stuff, it's set up. Okay, so one more tip with your shoulders. Watch your ears. You see this right here? Yes, that's me in a cartoon form. One side says no, the other side says yes. So what I want to explain with that is, whatever exercises you're doing, or if you're watching TV, or if you're sitting, walking, trying to stand up, don't take your shoulders up in your ears. If you're using your cane or your walker, try not to be up here, because when you're way up here, you're taking that shoulder joint and girdle, taking it way out of alignment. Then you're trying to get those muscles to work strong for you, completely out of alignment. That is a safety thing for people. They feel, oh, I got to be this way, but you need those shoulders down. Because once those shoulders come up, you're pulling all those shoulder joint out of alignment. It's even pulling your back muscles up and can cause back pain. You have fascia lines that run through the body. If your shoulders are up high all the time, it can literally affect the pain in this hip or this hip because it's pulling the fascia and the spine out of alignment. So remember that. Remember this goofy picture I'm showing you. This is a no. This is yes. So don't force your shoulders down. Just think, I might, zip up your abs, be in good posture. Remember, good posture doesn't come from throwing back. It comes from the torso being strong enough to hold you up. So I have worked with clients that have shoulder issues, and their shoulder issues don't get recovered better until they get their core strong enough to hold their body in upright position. So there's a few things you may have going on. Just throwing that out at you. And with that, I'm going to give you this knowledge really quick, and then we're going to go to your leg. Okay. So everybody has this muscle, and you may have remembered it from my books. It looks like a girdle, women wearing girdle. It's your transverse abdominal muscle. It's your deep ab muscle. It goes deep below the ones that people have six packs in here. It attaches at the pubic bone, wraps around your whole body like a girdle. When that is strong and the other muscles with it, it helps hold you up. When this is weak, it's harder to keep your body up for strength and balance. This needs to become strong to help you stay upright. And here it is in a different version. You can see your diaphragm, that's your deep psoas muscle, and then that big muscle going across here is this one. So think of your torso as like a tree trunk to a tree. Remember the apple tree in the backyard? It got hollow, so Shannon and I knocked it over. But if it was strong in the center, we couldn't have knocked it over. So if the center of a tree is weak, when the wind comes along, it could fall over. If it tries to hold apples on its branches and it's too weak, it's just not going to be able to sustain the weight of the apples. But if the trunk of the tree is strong, it doesn't blow over in the wind, it can hold a lot of weight of the apples. That's how the body is. If the trunk is strong, it holds you upright. Your arm can get more position and your legs can get more position because you're upright. Posture is essential. Okay, so with those tips, just to give you some knowledge with that, let's give you one more thing with sitting. Okay, we're going to go through some sitting. I was explaining to you on the phone the height of chairs and then the height of the wheelchairs, what they do sometimes. So if you look at these two chairs, folding chair, typical folding chair you get every store, every one of us has a folding chair, 16 inches off the ground. Now this chair here is one of Grandma's old chairs, which I painted white and have a different cushion on it. This chair is 18 inches off the ground. So if you look at them next to each other, if you can see in here, they're different heights. So when someone sits in them, if I sit here, I'm a little higher. My knees are pretty close to my hip height. When I move over to this one, my hips drop on an angle below my knees. It makes it harder to get up. The higher chair is a little easier to get up from. So what I do, I have my pad, I stick it in here, and I make my chair higher. That helps my back and spine too, because it puts too much pressure on your low back and sacrum when you're sitting like this. So often in wheelchairs, people kind of sink in there. Usually the cushion in the chair is flimsy like a pillow and it doesn't give you any support. And so what I have my clients do is get these. It's a cushion that I use for sitting at my desk. So when I sit at my desk, I have the iPad there, I have this there, and this is how I'm at my desk. My spine's more supported, I don't get as much back pain, my knees are positioned properly with my hips. So, and when there's a little groove in the back, and it's a lot thicker. It's not like a cushy pillow like you sleep on. It has no support, or a couch pillow or a chair pillow. It's made for supporting your spine, and your bottom sits back here, and this is where, like, you know, you're here. So the tailbone and the sacrum, it takes pressure off your tailbone and sacrum, so it's much more comfortable, and you're at a proper height. So when you're doing exercises, for instance, it sounds like you may be doing, you know, maybe some of this kind of stuff. If you're doing it all sunk down here, and especially if you're not even good posture up here, it's not going to work as well. And let me tell you why. So let's get this back out of the way. Let's get this back here. Okay. You have, I have to switch back my glasses. You have the psoas muscle, and you may not have ever heard of it, but a lot of people with back pain probably have. So this is a little version of the pelvic girdle, the psoas, and one of the hip muscles. Okay. Here it is here too. This is the psoas muscle. It's the only muscle in the spine that attaches to your legs directly. So this muscle, so you have 4 lumbar vertebrae. I'm trying to make you see this stuff more. 4 lumbar vertebrae, low back, lumbar. This muscle attaches to the top 4 of those 5 lumbar vertebrae. So it starts back here, crosses across that hip bone, and attaches at your thigh. So when people are sitting, people who sit around too long, that gets short and tight. So people, you need that muscle to help walk, lift. So this helps you flex and stand up. It helps you lift your leg in movement. It works with you when you're walking. So people that sit around and sit around and sit around, and then especially sitting in really low chairs, one, this puts major pressure on your low spine. And when you go to get up, this muscle is so short and tight, it's not going to be able to help you do the job that you need. It's not open to move and work. So that's why I wanted to show you that. So when you need these muscles to work, the more it's squished up sitting, when you need it to open up and stand, to move for walking and to help you lift and sit and stand, it's not going to be able to work that well. So remember this muscle, your psoas muscle. It's very important. Remember the image of it. Remember when you sit a lot, if you're sitting here, it's one thing, but once you sit and you drop your butt right below your hips in chairs that lower you, it's going to make it harder to get up. Getting up from here is much easier than getting up. Look at all the inches there. That's how many inches more that psoas muscle is squished up. When you're even down here, it's harder to get up. It's not lined up right. It's not positioned. So that's why I wanted to share that with you, because that little tip may help you just do a little better in your therapy because you just raised your hips high enough. You do not want your hips below your knees. You rather have them level with the ground or a tad higher. You do not want your thighs tilting back this way. Okay, so that's one thing I really wanted to share with you because I think that's important, and your posture. So when people are working on standing up, I tell them to imagine they're putting on a tight girdle. Do not squeeze your butt. Just imagine you're putting on a tight girdle, a tight pair of jeans. You've read this in my books. And I have people hold onto a bar that's on the wall. So my bar is on the wall. I have a picture of it right here. They are on the wall, securely on the wall. So if they pull, but you have to make sure your shoulders are ready for this. But you have a bar on the wall, and when you pull yourself up, you have that security to come up. So especially with people Zoom right now, I require them to have a bar on the wall if I'm working with them, if they're working on this kind of issue of standing and walking. So I just have this plain bar, not hooked to a wall, to show examples, but you need to secure in a wall. So when people work on standing, I know you grab the bar, you come from your chair, you're sitting, have a chair under your butt, and practice standing up in here, and then sitting back down. But you have to have your shoulders and your arms. You have to work with the therapists have to tell you if your shoulders are ready for something like that and when you're ready. And I know some people do these things at home, holding on countertops. You trying to stand and you have a grip, you're going to do better than trying to hold onto a countertop where you have nothing to grab onto. It's safer, first of all, and once you feel safe, you can secure yourself up. When your body's ready, make sure when you're practice standing that you're standing completely up. Because let me tell you what a lot of people do. They stand up, they get to here, and then they start walking. But if you stand completely up, get yourself in control, and then walk, you line up better for walking. When people stand up and they stop here, nothing's lined up right. Your hips can't work as well because you're not properly lined up. And then you go. But it is common in the beginning, people don't feel safe, so they don't feel safe to open up. So safety first, but no, that's the purpose of things. So here's a picture here about sitting in a wheelchair. This is my 86-year-old stroke survivor. One side there's an X, which means no. The other side is a check. Maybe hard to see in the camera. The side with the red X, my white arrows show how crooked his pelvic is. His feet are uneven, and he's sunken down in a cushy chair. If you look real close right there, you can see he has this cushion, and there's no support. He's sunk right past it. But he has a pad in this chair, like this one. Now he's able to sit up better. His hips are lined up. He's in the center of the wheelchair. Here he's sunk into the side, and so he's sitting in his wheelchair kind of like that. You can't exercise in that position, nor if you're in a wonky position like that, are you going to stand up. So you need to line yourself up centered, so when you stand up, you come up centered. So when he was trying to stand up and learn to walk, coming from this position, he could barely do it. Coming from this position, as he got stronger, he had a sense of control. Because you can't, sit like this and then expect your body to be here when you get up. Your body will try to go to the position it's in mostly. So if people sit like this, instead of like this, when you need it to be here for standing, it's not going to participate with you if you've been like this. So make sure your feet are lined up even. Don't try to stand up with one foot turned out and you're here and you're all like that. Get your feet anchored. Make sure they're doing the same thing. Because I'm going to come up real close. See my hips? Okay. Every time that foot turns out, look what it's doing in my hip area. It's changing my pelvic and hip position. So if you're trying to stand up or walk, but you have one foot like that, you just took your hip out of alignment. So you don't want to be like that. You want your hips lined up, which means your feet need to be even and getting really focused. So if you look here, you will see, Here is the pelvic in crooked position. See, this one's all lined up. See my straight black line down the middle? Standing up in that position is much easier and functionable than this. It's crooked, so the line is not straight, which means all the muscles, including that psoas muscle that helps your body do these movements, is not lined up to be able to strengthen and do its job it's needed. Plus, this is a deep muscle in your spine called the quadratus lumborum. If your hips are always like that, sitting and trying to stand, this muscle is going to be short and tight in one side, causing spine issues and unevenness because you can't line up and walk right. So there's the tips on that. And there's an exercise I'm going to show you now, and then we'll be done. Okay. You can sit in a chair and do this exercise I'm going to tell you, or a ball. You're not ready for a ball, obviously. But this is from the book. It's showing how I'm lined up. My feet are lined up. I'm sitting up tall. There's a ball on my knees. This man, my client, his foot's turned out, his spine's twisted, and his legs aren't even, which means when he's doing this exercise, he's not going to develop evenly, and the body needs to be evenly to function. So if you see the difference, even though I'm in a ball, he's in a chair, same exercise, just a little more advanced on the ball. Sitting up tall and the feet lined up will make things work better. You don't want anything twisted. Okay, so with that, one more thing with this for you now. Okay, when you're sitting and they're having you doing those exercises, kicking your leg or lifting your leg in and out, you have 4 quad muscles. They come down here. They all attach right into that kneecap. They come right through here. So they flex and they help you do this. But take that muscle off. And now here's your thigh. This is your hip bone. There's your pelvic bone, hip, ball, and socket joint, and right here. Those muscles are right here inside the thigh. Those muscles need to be strong to stabilize your leg for walking. They help keep your leg in when you walk. So when people are kind of weak in their legs, just doing the 4 quad muscles is not enough. You need to work the muscles that help keep the thigh bone stable for walking. So if you look real close again, see all those inner thigh muscles? Those are your inner thigh. Your quad muscles are coming, they come down on top of it. Take that out, and this is what's under it. They're not hard to strengthen. You can simply do that with a ball. This is a ball for exercise, but you can use a kid's ball. The ball, it's gently to squeeze. You sit down in proper position, sitting up tall, a little bit out here, not way back in your seat. You move up a little forward, feet lined up. Don't have your feet here. Have them directly into your knees. Put the ball between your knees. Squeeze, release. Squeeze, release. Do not squeeze your butt. Gently squeeze the ball in and gently release. Don't squeeze and snap. Squeeze, release, squeeze, release. This will help get the legs stronger to stabilize for walking and standing, because you need the strength in your legs to hold your legs up. So there's the tip for that. Easy to do. Very easy to do. But you don't want to do it in the edge of a cushioned couch. You want your spine and your hips in stable position, posture, in good posture, and squeeze and release. Okay. And one more exercise. When you're able to stand with a bar, I lost my bar. Okay. Pretend like I'm on a bar, it's hooked on the wall. You start at one end of the bar and you just take little steps. Oops. Sideways, sideways, sideways. Step back again. So each time your leg steps out, you're working these muscles right here that help abduct, B for by leaving the body, abduction and adduction. So those muscles, these are your adductors. They flex, they bring that leg back in. So as you're taking steps, working this part to step out, working the inner thigh to pull it back in. Step out, inner thigh pulling it back in. Back the other direction, the opposite leg. That goes, this thigh's pulling it back in. So you may not be ready to do that stuff because you need a bar and you need to make sure you can use your shoulders to hang on with. I don't think you're ready for that yet. But those are some tips you can do. And when you do get back home, get a bar in your wall. When you're stronger and do stuff, you can practice this stuff. Because people can also practice walking, holding onto the bar, you know, walking forward, practicing walking with the bar safely, not walking like this, but walking in here. When you do this, you stand up tall. I know my head keeps getting cut off. I'm in my living room, so I keep getting cut off. So there's a bunch of tips for you. I sent you a YouTube video because I can take my videos, I upload them to YouTube. That's different than me just sending you a direct video. I don't know if I'll be able to send this to you directly to your phone, on your phone, but I can maybe upload it to YouTube for you. So yes, it's long, but I think having this knowledge will help you in the long run in time when you're ready to do other things. I don't see why you can't add this one in right now if they have a ball for you. I know some people may squeeze a cushion, but a ball is much better. Yeah, you need those muscles that stabilize the leg to get strong too. Just this exercise is not enough. But they may have you be doing this stuff and I don't know, and that's okay. But if they are, that's why they're doing it, because you need the right muscles stabilized. And when you're ready, this is your glute muscles, your butt. That big butt muscle, those muscles help you, that flexes. So you need all this kind of stuff for walking. So when you're ready, getting your butt muscles strong will help you walk too. And what I have people do, especially the people that can't go to the floor, holding on a bar, you hold a bar, have them turn one foot out slightly, and you squeeze your butt and you do little tiny lifts to help work that butt, because walking has, you know, that leg has to come back and forth. It works everything. 70% of your body muscles help you walk or are involved with walking. So that's my tips for you. I hope it helps. I hope it gives you a little knowledge and make a little more sense when they're talking to you. Watch your posture. I really suggest seeing if they can get you something more steady in your wheelchair. Maybe when you're done at this place, Johnny and I, or him or me, or someone could get you one ordered off Amazon. You can put in a wheelchair to help you, because it's much more comfortable on your back. Because when our hips are all wonky, it puts all this pressure on our spine, and we don't need any more back pain. I know, I sure don't. I get so much of it. So there you go. I hope this helps you with this video. Went to 27 minutes long. So you can replay it. I try not to talk too fast, but sometimes I do, and that's just who I am. But anyway, okay. Good luck with everything. I'll talk to you soon on the phone. Probably not in person because they won't let us see you. So, bye. Wasabi. Wasabi, looky. Who's that? Want to say hi real quick before we get off the video? We'll take it over here. Wasabi, who's that? Who's that? Is that Grandpa in the hospital? Who's that? Is that you? You're a good boy. I know it's rainy, so you're not walking. We'll walk in a minute. Say bye-bye. Bye, Grandpa Stanley. You want to say ow? One more time. Ow! Yeah, he's lazy. He's sleeping. Okay, so, bye.